during the
I'm
coronavirus
recording
crisis.
for you.
A group of charities led by Action on Hearing Loss and the Royal National Institute of Blind People have told the government they're concerned over the way the particular needs of disabled people are simply not being taken into consideration in official communications. And for blind people who find many social distancing measures a challenge, there are calls to be considered as vulnerable so that they can get priority access for online shopping. Anya Pop has this report.
As governments around the world give vital updates about coronavirus, spot the odd one out. France.
Mais pour le 3e jour consécutif.
Norway.
They're all do signing, Fiona.
Japan. Italy.
Ma questo lo dobbiamo afferrare tutti.
South Korea. New Zealand.
We should not confuse the success of our actions with overreaction.
Even Bolsonaro's Brazil. Scotland. Wales.
For their support for our preparations.
And then the coronavirus announcements from Downing Street.
People are anxious to know when we're going to relax restrictions, when schools are likely to be fully back and open again.
Unlike many other countries, the British government are not providing an interpreter for people with hearing loss at their daily conferences, a situation that for deaf people like Lynn Stewart-Taylor means often feeling left out of key announcements.
Information going out in sign language is very, very limited. I think the deaf community are really suffering. This is a life and death situation, and this is no longer acceptable. We don't want to have a massive delay to access.
Oh, wait a minute. You can't go in front of the telly at the minute. No, don't go.
I've grown up
filming,
having
sweetheart.
barriers to access, so I suppose I'm quite used to it. But this has really affected my mental health. It's given me panic attacks. I've been very upset. I'm really, really worried about the other members of our deaf community.
Lynn is part of a campaign to include deaf people in the live national addresses. We've been shown this letter sent by leading disability charities to the government on Friday, expressing significant concerns about accessibility of public health information. In it they point out that 4.5 million people suffer from hearing or sight loss in the UK, groups that they say will be overrepresented in those most at risk of serious illness as a result of COVID-19. Charities say many official information campaigns on social media at the moment do not contain markers needed for a programme that reads written words out for blind people. And not being able to see fully also makes social distancing difficult.
A lot of people with a visual impairment will have some degree of useful sight. That will mean if they're going into a store and they want to look at goods, or if they're say, crossing a road and they're reaching for some indication of where the crossing is, they reach out and touch. That's part of that. And obviously with social distancing, that creates an increased risk.
Keith, who is blind himself, wants visually impaired people added to the list of vulnerable during this crisis.
The charity sector can't do this on its own. It needs some sense of understanding in government and amongst supermarkets that this is a genuine problem, but a problem that we can solve together.
The government says it's vital public health information reaches everyone, and that they have reminded departments of the need to make communications accessible for all. They say they've received the letter and will reply in due course. Those charities behind the letter will be listening or watching closely to see if that accessibility becomes more than just words.
Well, now there are many other issues surrounding disability in the current crisis, not the least of which are concerns over how hospitals might approach treatment. Disability campaigners are worried that they might not get the proper level of care, so they want the guidelines to be looked at by the courts. Earlier I spoke to Doug Pawley and Catherine Runswick-Cole, who are both involved in that judicial review, which is due to be launched tomorrow. Doug is disabled and lives in a care home, and Catherine's son William has a diagnosis of hearing disability and autism. I began by asking Catherine about her concerns on official guidelines regarding medical treatment of the disabled during the COVID-19 outbreak.
It's all unknown. We don't know how decisions will be made about how resources are allocated. But I do know, as the parent of a young person with a learning disability and autism, that in the past people have been discriminated against. We've had examples of do not resuscitate notices being given to people with learning disabilities and autism. So I'm very anxious about what might happen to him if you're admitted to hospital.
And Doug, do you feel that you have exactly the same access to treatment, particularly if you get the disease, that anybody else would have in the health service?
I've got concerns about it. You know, and in the absence of government framework for decision making, doctors on the front line have got this unenviable job of trying to work out who gets the treatment if there's too much competition for it. And I worry that disabled people like me and other people will end up not getting the care that they need and deserve and that other people would expect, simply because we've got, you know, existing conditions.
Well, that must be a widely held worry particularly amongst people with disabilities. And I'm wondering, Catherine, this is obviously a hypothetical question, but in the event that your son did, alas, get the disease, is it guaranteed that you would go to hospital with him to ensure that any communications and rescue were clear?
I think the guidance has changed on that, and I think it might be possible for me to go to hospital with him, but I'm not absolutely sure whether I would be able to. So I've tried to prepare for that situation. So I have a one-page profile which tells people a little bit about how they could communicate with William and the sorts of things that he would need extra help with in hospital.
Catherine, what do you hope to get out of the case?
Well, I really hope that the Secretary of State will produce guidance, and that guidance is produced in consultation with disabled people and their families, and that it reflects a commitment to the United Nations Convention on the Rights of People with Disabilities. And I also hope that this conversation, where we began to talk about human value in very open ways, those discussions were kind of going on behind closed doors, and as we move on in time, we start to move away from this pandemic. I think we need to think about the value of human life and the value of those that we marginalise, and to try and change some of the health and social inequalities that were there before this pandemic, but that the pandemic has shone a light on, if you like.
I can see, Doug, that you're absolutely in unison with that. But let me ask you this. I mean, we haven't had the opportunity very often to actually speak to people who are in care homes, and there's great concerns about care, if you like.
Yes.
What's your sense of that?
It is a uniquely vulnerable position to be reliant on people and PPE and services that you have no control over. I mean, disabled people in the community will have similar concerns, I know, but you know, I rely on people coming in on the bus from Leeds every day to come and get me up, help me to the toilet, all the things that a lot of other people can do for themselves. It's quite disconcerting and worrying that we have a sufficient PPE, because a member of management in the home very presently and sensibly ordered a huge amount to put upstairs ready for if it was needed at the beginning of the crisis. There's been a major problem with access to testing. We have had symptomatic residents here who may have had coronavirus, which is obviously very concerning and puts people on edge and very stressful, but the home hasn't been able to access testing for those individuals.
Catherine, what's your concern in terms of where your son lives now?
Usually have the support of support workers, so we would usually be volunteering with the National Trust and going out with support workers, but we made the decision about 4 or 5 weeks ago that we wouldn't have support workers in the home anymore, so we're supporting him ourselves, and we're working very, very hard to shield him, but also try and keep some of his routines the same, ensure that he can do the things that he loves, like going for a walk and gardening and so on. So all of that's quite difficult for us too.
Does he understand what's happening?
He sort of does understand what's happening, sort of understands. It's quite difficult because he likes to go over and over to try and understand things better. And he's really angry about the virus, as lots of people are. He's really angry about some of the things that he can't do.
Well, thank you both, Catherine and Doug, very, very much for your different but quite similar concerns. Thank you very much.
Thank you.
Thank you.
Well, let's return now to that extraordinary collapse in US oil prices to historic